Yes, you're all set.
Yes.
Great. I apologize, folks. There's a couple of jets going by overhead. I'm going to give it just a quick second for clarity to let them get over my airspace here. All right, I do apologize for that. Hopefully you can hear me. I think they're headed out south here. So yes, thank you, Erin, for the introduction. I wanted to share with you some really exciting information that we have now available in Care Navigator related to how we are helping you in the field prioritize individuals who are in need of care coordination. And I know many of you are familiar with the fact that we've been looking to identify and have identified for 2021 some specific subpopulations of focus for the year related to care coordination. And those specific subpopulations are folks with high ED utilization, high inpatient utilization, and those individuals with a high total cost of care. And what we've done to support you in that work and support outreach and engagement of these populations is we have built into Care Navigator 3 new patient prioritization lists that allow you to further hone in an easier way to see individuals that fall into those populations so you can take next steps with them. So what you see on this slide essentially is definitions of the 3 views that we currently have available to support those. You can see the high ED utilization is defined as more than 6 ED visits in the last rolling 12 months, and that will include, available claims data, which will continually be updated. High inpatient utilization is defined as more than 3 inpatient visits in the last rolling 12 months. And we also included a group of individuals who do have a high care coordination risk level, combined with a high social risk score of 3 as another prioritized population. So what you'll see on the next slide, we'll talk a little bit about how you'll be able to view those lists in Care Navigator. But first we want to talk about the rationale for this. So, essentially one of the important rationales is that this really helps support the kind of healthcare system transformation that we are all really focused on and working so hard to make happen. And we know that people who have high system use, very often they have a lot to teach us, right? They can act as super detectors in the sense that they're really helping to clearly identify where there are system inefficiencies or breakdowns or gaps and how those factors influence low value care. So we're looking to really learn from those populations. We also know high utilization, and many of you see this, really can result from, as well as contribute to, uncoordinated care and avoidable utilization of inpatient or emergency room acute settings, as well as poorer health outcomes. And care coordination really, and effective shared care planning is that linchpin for the management of people who fall into those categories. We also know folks who have frequent acute healthcare encounters, really they're often doing so because of complex mental health or social needs, even if they have numerous medical conditions. So really pulling that robust care team to wrap their arms around effective shared care planning, which is essentially our model, is really important for those individuals. And of course, our goal is really to improve the quality of patients and Vermonters' lives through this collaboration that we have across the spectrum of life, so psychosocial, economic, as well as clinical factors. And we know that if we can be successful in reducing avoidable utilization, there'll also be an improvement in provider quality of life. So that's a little summary of the rationale. The prioritized list that you will see, a couple of key things about those lists. They're essentially a tin level view of patients in each of those subpopulations. And those lists will be for organizations who have attribution, so primary care settings. And those organizations and TINs will be responsible to sort of look at their list. You're going to want to review it and initiate, coordinate, or participate in, as it makes sense, care coordination interventions where applicable. And we'll talk about what that can look like next, but specifically, it'll be an encounter of a certain type that you can reflect, as well as, of course, care conferencing. Preferred providers and collaborators will likely be involved on care teams in one way or another for many of the patients in these views, but that list view will not be available to those folks. Those will only be visible for organizations with attribution. The Medicaid expanded population isn't included in these views, but once they become attributed through that, good relationship and establishing that with a primary care medical home, then they will become attributed and we'll be able to see if they fall into any of those lists. The last point would be that these views are dynamic. So as we continue in that rolling 12 months, right, we'll continue to receive updated claims data into Care Navigator on a monthly basis. So there may be some new folks who move into those categories, and you'll be able to be aware of that when you're looking at your list. And the next slide, we'll talk a little bit about, I think Danielle or Erin will do a quick demo, but how do you find these? So we added these as system views. So this is readily available if you start from your active patients view, not my active patients, which is folks you're on the care team of. Go to your active patient view, and then you'll see in that little caret drop down next to active patients that you'll now see these three lists that'll be available to populate. And that's where you'll be able to view folks who fall into whichever list you're choosing to view. The next step, once you view the list, is really, looking at and considering who you're going to be engaging from, which we'll talk about in a minute. And one of those things, if you can go back to the encounter slide, please. One of those things that we've added is we have added a new reason for encounter, which is there. You'll see it prioritization list outreach. So this is a checkbox you can use to indicate, yes, I'm reaching out and conducting this encounter based on the fact that this person's been identified in one of these categories. And you can still continue to choose multiple reasons for the encounter, so you can then cascade down to check any other checkbox that is relevant. And that will allow you and us to really see that actions and next steps are taking place with these folks. And I don't have a specific slide for this, but of course we'll talk in next steps about where the care conference falls in. Just a brief summary of next steps. You're related to, taking a look at these lists. First, of course, you want to share this information and these slides with other people in your organization. These list views are new, but you want to let people know that they exist and you can take a look at them. Watch for a July 14th 12-to-1 care coordination training around interventions and workflows specific to these populations that we'll be offering. You want to take a look at your list, and then really, you can huddle with providers or staff teams to really review the list, what you see, discuss individual patients, and really think about and identify patients for next steps in intervention. You want to conduct and document that encounter with the prioritization list outreach as the purpose for both patients that are currently managed, and you will see, right? You will see people that are already engaged in shared care and at the care managed level. Record that prioritization list encounter outreach, and as well as for any new folks that you identify to take those steps with. And then for patients that are already care managed, it's a good opportunity to really review that care plan for updating, connect with the patient, plan a care conference, pull in some other team members, and communicate across that team. You want to think about using motivational interviewing techniques to engage individuals and patients, and you can refer to the MI trainings that we have on the Vermont Health Learn platform. You can email our help desk if you have questions about how to get access to that. And really, as you evaluate these patients, and we'll talk more about this in our care coordination training in July, really look at determining the drivers of that utilization. And very often, this is not a medical in nature, even though folks may have multiple medical conditions happening. You conduct social determinants of health, other assessments, form the care team, engage the individual throughout that process and in the shared care planning, and then really conduct ongoing monitoring. So those are just some really quick next steps. I would say really focus on sharing this information and the slides, watch for that training and sign up for it or attend it, and then really review your list and start some of those initial next steps. So thank you, Erin. You can go ahead and move forward in the slides. Appreciate it.
All right, thank you so much, Robin, for sharing that. So since Robin kind of touched on that, I just want to go ahead. I know this is kind of off script a little bit, but I'm going to go ahead and show you in Care Navigator where that lives, just so you can see a visual that might be helpful. Let me just go ahead and share my screen 1 moment. All right. So as Robin was saying, this is going to be in the patients, and I am in staging. So these are all test patients. We always just like to let people know of that. So these reports will be in the active patient tab. And if you drop down the drop down caret that Robin mentioned, you'll see these lists right here. Now the first one doesn't have anything because again, I'm in staging. Actually, it does now. So you'll see this is the high ED utilization patients. And then the high IP utilization patients. And then the social risk as well, high medical and social risk. So that is where this lives. So again, once you're in Care Navigator in the home screen, you'd want to navigate to the patients, orange patients tab, and do the drop down. And it's going to be these 3 reports that Robin was referring to. Not necessarily reports, but almost views. All right. So just some other items that we were going to touch on. Since I'm already in Care Navigator, we had some questions about the lead care coordinator change history option that we can see. So I'm just going to go ahead and show you what that looks like and just talk a little bit about that. Since Robin did take some time doing that, I'm just going to kind of hit on some of the hit points that we had on our agenda. So I'm going to go ahead and show you the lead CC change history. So I'm going to go into my patients list. I'm just going to go into my patients, my active patients, and show you what that looks like. So we have the change history right down here. So this is the current care team. You can see that right here. And we had some folks wondering what the change history is. So what you'll see down here is the lead CC change history. And this is any time that someone on the care team goes ahead and changes the lead care coordinator to someone else. So you'll see right down here, I was removed as the lead care coordinator. And you can see right here today that I changed it to Danielle and I assigned her as a lead CC. And it will ask you for the reason for the change. So I'm just going to show you what that looks like. So this is the current care team. And if I were to go in here and select Elizabeth, and I'm going to go ahead and select Elizabeth as a lead CC now. Let's see. All right. One moment here. All right. Let's try honey. Okay. One moment here while this cycles through. All right. You'll see I'm going to just select the participation type. And it's going to prompt me that there is already a lead care coordinator and asking me if I want to change it. And I'm going to add internal staffing change, and I'm going to write changed lead agent, and I'm going to save that. We have those lovely F-35s going over again. I apologize for that. All right. So you're going to go ahead and see that Honey is now the lead CC. And if you were to navigate back to Juliet's page and look at the lead CC change history, it should show that I changed it from Danielle over to Honey now. Just going to show you that. All right. And you'll see right down here, it shows that I did remove Danielle. And it does even write the change. The care coordinator was removed, but is still on care team. So that's what the lead CC change history is. It's any time that you were to change the lead care coordinator, and it's going to send a alert over to the person that was removed, and it's also going to record that here. So if you were to wonder why someone was changed or removed, it will show the reason for change right down there and who changed that lead care coordinator. All right. Now we had some questions about reactivating a care team member. That can also be found right in the same section. You would want to hit the associated view, which is the little grid right here while you're in the current care team screen. So I'm going to hit the associated view. It shows all active care team members. And then if you were to select inactive care team members, you'll see that Kathy is an inactive care team member. If you were to want to reactivate Kathy, you would select, there's a little check mark right by her name, and you're going to hit activate. Going to go ahead and select activate. And once you go to active connections, you can now see that Kathy is again on the patient's care team. Now again, this is active connections. To see any inactive connections, you would want to go to inactive connection associated view. And you're going to click that. Now this does not have any inactive connections, but this is where you can find and reactivate anybody that is inactive on the care team that needs to be on the care team again. All right. So I'm going to go back to Julie and just hit on some other items that we had. So we had some questions about the encounter log the last few weeks from some folks in the field. And we wanted to just touch on, we did, I'm not sure if folks have noticed, but we did add a word count in the encounter log. And we wanted to just send out a note to folks that once you're in the encounter log is really meant to do some quick notations. It's not intended for a copy and paste from an EMR. We just wanted to hit on the word count really drives home that it wants to be quick and concise, not a copy and paste field. And that was just a question that some folks had, like, oh, why did you put the word count in there? We wanted to put the word count in there to really drive home that it's just for quick notations pertaining to care coordination and to this patient. It's not intended for a copy and paste functionality. I do believe that is it. I don't know if I want to pause for a minute. I know that we kind of sped through those last few. Danielle is monitoring the Q&A area. I just wanted to check in to see if there's any questions or requests as I'm going to navigate away from Care Navigator and just touch on some other items. Danielle, is there any other questions or?
There hasn't been. Robin and I have been able to answer them so far, so we're good.
Okay. Yeah, all right. So we do have, I just wanted to touch on, we did change the resource page. We always like to just highlight that as part of our demos. So I'm just going to go into OneCare. I usually have this bookmarked, so hold on just a moment. All right. So we did change the location of our resource page. I just wanted to show folks where that is. We did change it to under the providers. It was previously under patients, which, as you might know, did not make much sense. So we changed it to providers, and it's going to just live right there. It has the same information that it always has. It even has the same hyperlink, but we just wanted to show folks it is now under the providers tab. And here, just for folks that might have not joined before, we just wanted to let you know that it does have the same information. It has some modules in there. It also has our OneCare Access System Access Forms. So our system access forms, just to initially sign up for Care Navigator usage, lives in this area as well. We have our user guide, and we also, importantly, this is where our user group trainings live. So once we do our user group call, we do usually by the following Monday post the user group call once it's recorded right on here. So this is where you can see any previous user group call, or the most recent user group call lives on this page. And then we have some basic FAQs, and then some items on how to add a care team member, non-ACO, so on and so forth. I'm not going to go over every one because if you'd like to check it out, you can navigate right to this page. All right. And then just one last thing that I have before pausing again for any questions or comments or demo requests. We do have some folks that often have some trouble with their cookies and cache, and I just wanted to go over some tips and tricks for logging in. Sometimes we notice that some cookies and history need to be deleted or cleared before folks log in. That seems to be a barrier for some reason to logging in for folks. It's not a user error, it's just for some reason the way Care Navigator works. I think it caches cookies and other system information onto your computer, and we just wanted to remind folks that that's always one go-to tip that we say when folks email us and say, I can't seem to log in. It seems to be an endless cycle for me to log in. Before we do password reset, we always like to tell folks to go up to their system tools. This is Internet Explorer, but Chrome and Firefox are very similar. And that would live in the Internet Options box. I'm not sure if you can see this, but in Internet Options, it shows to clear browsing history and to clear cookies and cache. That's always one go-to thing that we always tell folks. Please ensure that you clear your cookies and cache and not to log in using any saved usernames or passwords. That always seems to be a little barrier for folks to log in, and that's our go-to kind of tip and trick we wanted to share. Again, it's been a little bit before since we've reminded folks that's something that you can do. I do believe that is all I had for today. I know that was kind of quick, but I can pause if anybody had any questions or concerns or demo requests. I'm happy to do that as well. Danielle or Robin, do we have any questions or anything, any requests?
I don't see anything. There's one that I'll probably go offline on.
Okay, perfect.
I was having trouble with the encounter log.
Okay, all right. Robin, can you think of anything else I might need to add, or any other thing that might be helpful?
Thank you, Erin. I can't think of anything at the moment. It was helpful, I think, what you've demonstrated, and I would defer to the group if there are things people would like to see, even if it's something you think that's been covered before. It's always a really good time to ask those questions, because if you have that question, chances are somebody else does and just doesn't want to pipe up about it. So I'm just going to go ahead and answer this encounter question in the box and pause to see if anybody else wants to ask any kind of question.
All right, we'll give that just a few minutes. All right. All right. Well, just to let folks know, if you do have any questions, you're always welcome to either call us or email us. The help desk email is helpdesk@onecarevt.com. onecareVT.org. You're always welcome to ask us any questions, comments, or concerns. We're always helpful. Happy to log in and do a screen share with you folks. We know some folks are still working remotely, so we're always happy to do a screen share if you need to for anything that you need to know, technical wise, or connect you with a department within OneCare that might answer any questions or concerns that you have as well. So you can always reach out to us in between user group calls for that as well. Just checking in, is there any other questions or comments, concerns, demo requests?
There isn't, Erin.
All right, quiet group today. All right, so without further ado, again, I'm just going to welcome you folks to always reach out to us if you have any questions. We will send out this recording and the slides. And also, as I mentioned before, our recording will live on the OneCare VT website. We usually have that by Monday or Tuesday following the Care Navigator user group. So without further ado, just thank you for joining us today. Again, please reach out to us if you have any questions or comments, concerns, or requests to connect. We're always happy to do it, a Teams meeting in between or anything that you need. All right. Thank you so much for joining.
Sorry, Erin, you can
Yes,
also feel free to reach out to us if you or folks have questions about the prioritized patient list views and any workflows or next steps. Please feel free to reach out to me or to care coordination at onecarevt.org, and Tracy and I'd be more than happy to get you some support or answer those questions.
Yes.
Thanks, Erin.
And we'll send out all that contact information as well within the slides, and also in our follow-up email after this meeting has ended.
Questions?
I'm sorry.
We welcome questions.